At the IGIA Senior Plenary session in Washington, D.C., Lieutenant Governor Joshua Tenorio spoke before federal leaders, reminding the room that Guam is more than a dot on the map. It's a home to many and a frontline partner in America's defense.
Mr. Secretary, Director Meyer, colleagues, Guam is often called the tip of the spear, but a spear is only as strong as the commitment that stands behind it.
Tenorio thanked federal partners for past progress in resolving Guam war claims and Medicaid funding, but he warned that Guam's most pressing needs cannot wait. Chief among them, a $400 million funding request to build the Mangilaw Hospital.
Our top priority is health and safety. That is why we are requesting $400 million in federal support to construct a new public hospital.
With Guam facing cyber attacks from China and threats from North Korea, Tenorio framed the request not as a local project, but as a national security investment.
A modern public hospital would be built to handle mass casualty events, natural disasters, and risks tied to growing military and industrial activity. It would ensure immediate access to care for civilians, for our veterans, for our warfighters and their families.
He noted that the U.S. is investing more than $12 billion on the military buildup of Guam, while the hospital request represents just 3.3% of that amount, a quote fraction that will save lives, protect readiness, and counter China's soft power influence in other islands.
Beijing has donated hospitals in Papua New Guinea, sponsored health programs in Fiji, and built clinics in the Solomon Islands. These projects extend influence and mask strategic intent. By contrast, a U.S.-built hospital on Guam would demonstrate that America invests in its people, its readiness, and the resilience of its allies.
Beyond healthcare, Tenorio pressed for affordable airline services, reliable shipping, and stronger broadband infrastructure support through the maintenance of Guam's $156 million BEAD program allocation to protect communication systems and ensure cybersecurity readiness. Other urgent requests included reinstating the $30 million appropriation for compact impact costs, explaining that improvements to Medicaid for COFA citizens does not cover the hefty costs of education or public safety.
Currently, orientation grants are funded from Guam's Limited Technical Assistance Program. Since compact impact is a federal responsibility, we request that these grants be funded separately by the Congress, with the administration's support.
Tenorio pushed for Guam's inclusion in the Radiation Exposure Compensation Act as well, citing decades of fallout from U.S. nuclear testing in the Pacific that continues to impact our people's health to this day.
Extending RECA would finally acknowledge our people's sacrifices. We ask the administration to support Guam's inclusion through any available legislative vehicles, including the NDAA, that will get this job done.
Tenorio even calling out the danger federal funding cuts have put Guam in by reducing resources available to the Guam Environmental Protection Agency, which plays a critical role in reviewing building permits, safeguarding coastal waters, and ensuring both local and military projects meet safety standards. To end, Tenorio requested that Secretary of Defense Pete Hegseth reconvene an Economic Adjustment Committee to coordinate among 22 federal agencies, last done in 2010 to address Guam military buildup impacts in partnership with the IGIA.
With expanded military programs now underway and planned for Guam, it is essential to convene this committee again to address cumulative impacts and infrastructure needs. This will strengthen our close partnership with the Department of Defense and will meet the military mission.
Overall, Guam's message in Washington was direct. The challenges are mounting and federal action cannot be delayed. Nevaeh Anderson, KUAM News.